Good afternoon and welcome to our webinar, A Compassionate School Approach to Children's Mental Health, Equity, Justice, and Overcoming Disparities, with CEI researcher Megan Wenzel and special guest CEI educator and STEAM consultant Dr. Arenthia Harris. My name is Dana Asby and I will be your webinar manager and host. Today's meeting will last approximately 1 hour. A brief 5-minute check-in with the Childhood Trauma Learning Collaborative Fellows will be held immediately following the presentation. We ask that fellows remain on the webinar platform for this meeting. Microphones will be muted during the presentation. At designated times, for example, during our question and answer session, you can use the raise your hand feature to request an open mic or submit a question in the chat box. When speaking, be sure to eliminate background noise. Thanks to a partnership with C4 Innovations, we're offering 1 hour of continuing education credit for participation in this webinar. We can also offer you a certificate of participation. Registration affirms your consent to receive an evaluation follow-up link via email and your consent to recording. If you experience any technical issues, please send a private chat to Ingrid Paget, our technical support manager for today's webinar. We're pleased you joined us and I'd like to now introduce Dr. Christine Mason, founder and executive director of the Center for Educational Improvement and project director of the Childhood Trauma Learning Collaborative.
Good afternoon, everyone. So pleased you can join us today. Let me tell you a couple behind the scenes stories. Well, Megan Wenzel has been working with us at CEI for something like 5 or 6 years now. She does a lot of the behind the scenes work on editing, and she is a co-author of an upcoming book that we have on children's mental health, A Compassionate Schools Response. So it's such a delight to have Megan with us today. And then Arenthia's been working with us as well for 5 or 6 years, and she just defended her dissertation today. So welcome, Dr. Harris. And anyway, we're glad the whole community's here, and we really believe this is a really important topic right now, thinking about COVID-19 and all the inequities, the disparities, the things that weigh heavily on our mind when we know that children can't access learning. So we're glad you're with us, and have a good session today.
Thank you, Dr. Mason. Now I'd like to introduce today's presenter, Megan Wenzel, who is a researcher and writer with the Center for Educational Improvement. She's also a member of the research team at Factual, a startup company focusing on location data. In this role, Megan establishes research standards, processes, and metrics, builds partnerships across teams, and leads research efforts across all products. And now I turn it over to you, Megan.
Thanks, Dana. Thanks, Chris. I'm excited to be here. Thank you, everyone, for joining. So today we're going to talk about children's mental health and overcoming disparities. First, we'll review some trends, examine underlying causes, and explore current inequities in access and care. And then we'll discuss concrete ways we can address these disparities and provide justice for our children. So schools have the opportunity to improve mental health for all children. By creating compassionate, supportive, and connected environments, we can increase student resiliency and help reduce disparities in mental health. The Learning Collaborative is a great way to learn and work together. So to begin, we'll understand the current state of children's mental health. So today's children are increasingly depressed and anxious. This is due to academic pressure, violence, poverty, social media, and bullying, among other stressors. As stress, trauma, and anxiety increase, students are more likely to experience mental illness. The National Alliance on Mental Illness reports that 1 in 5 children has a diagnosable mental, emotional, or behavioral disorder. However, only 20% receive any treatment. When researchers asked teens about problems they see among their peers, anxiety and depression were top of mind. You'll also see that drug addiction, alcohol, teenage pregnancy, and gangs are concerns, and all of these can lead to anxiety, depression, and mental illness. So we'll start off with a poll. So which of these issues are you most concerned about? and so everyone take a moment to answer that, and then the results will show.
The preliminary results are showing, and it's 82% anxiety and depression.
Okay, cool. Thanks, Ingrid. So from here, while the overall occurrence of mental illness is relatively evenly distributed across, okay, now I see the results. Cool. So while the overall occurrence of mental illness is relatively evenly distributed across racial lines, access to quality treatment is not. So rural, low income, and children of color consistently have less access to high quality mental health treatment. These communities face limited service options, lack of resources, and a variety of barriers that other communities do not. The American Psychiatric Association reports that African American children are 1.5 times as likely to have unmet mental health needs compared to white children, while Latinx children are 3 times as likely to have unmet mental health needs. Researchers at Hofstra Northwell School of Medicine and the City University of New York at Hunter College analyzed nationally representative data from the 2006 to 2012 medical expenditure panel surveys in order to examine delivery of mental health services to children and young adults. They found that African American children have 37% fewer visits to psychiatrists and 47% fewer visits to any mental health professional compared to white children, while Hispanic children have 49% fewer visits to psychiatrists and 58% fewer visits to any mental health professional compared to white children. As children become young adults, age 18 to 34, these disparities only increase. Overall visits to mental health professionals were 68% lower for African Americans and 62% lower for Hispanic young adults compared to visits for white young adults. These numbers are very concerning and have very real impacts on life outcomes. As many youth of color experience discrimination and chronic racism, many of you have probably heard about Ahmaud Arbery, a Black man in Georgia who was murdered in cold blood while jogging by a white father and son this February. The white men claimed that they thought he was a suspect of a burglary, but his only offense was being a Black male. These men stalked Arbery, projecting criminality and suspicion onto him. It was only once a disturbing video of the incident surfaced last week, a full 74 days later, that any action was taken against the father and son. Simply put, this would not have happened if Ahmaud was white. In addition to these heartbreaking events that occur all too frequently, people of color experience compounded community trauma when they witness violence in both their homes and in their neighborhoods. This trauma, in turn, may surface as behavioral or emotional issues, but when they display aggressive or disruptive behaviors, children of color are typically punished and even incarcerated without consideration as to whether these outbursts are actually symptoms of untreated mental health problems. Thus, not only do they not receive needed care, but they're thrown into the juvenile justice and welfare systems, which themselves increasingly exacerbate trauma and emotional and behavioral disturbances. This creates a negative cycle of trauma and unaddressed mental illness.
So I just wanted to chime in. This is Dr. Harris, and I wanted to chime in about systemic inequalities. We as educators have to understand that the systems have legally and socially sanctioned privileges and rights to one group of people while at the same time denying those same rights to others. So we as educators can band together to remove the barriers that perpetuate systemic injustice. And we have to look at it from a point of a broken system and not a broken child. So if you look at the 3 pictures on the screen, the first 2 pictures presuppose that that barrier, the fence that they can't see through, is okay, and it's not okay. So true justice doesn't just give assistance so that the kids can see over the fence, it removes the fence altogether because the system is what is broken. And just as Megan mentioned about the murder, it is a systemic issue. And so when we approach things like mental health and things for our children, we need to approach it from the standpoint that the system is broken and not the child. I hope that makes sense.
Yeah, thanks, Renthia. Great. And so we all know that bullying is also a big problem. It can affect anyone, those who are bullied, those who bully, and those who witness bullying. Bullying is linked to many negative outcomes, including mental illness, substance use, and even suicide. In rare instances, students who are bullied may retaliate in violent ways, such as school shootings. Bullying and harassment feed off many forms of social inequity, including homophobia, transphobia, racism, and sexism. Children living in poverty are often bullied for a variety of reasons that they cannot control, such as dirty clothes, hand-me-downs, body odor, receiving free or reduced lunch, or having a parent with an obvious health problem, mental illness, or other disability. Microaggressions, like casual slurs such as "that's so gay" and stereotyping, reinforce a sense of disconnection and distance from their peers. Instead of focusing on differences, Yvette Jackson urges educators to identify and celebrate students' strengths. There is damaging neurobiological impact from otherizing labels such as low achiever, minority, or subgroup on learning and achievement. Such marginalizing language is associated with prejudice, degradation, and stereotype threat, and it can incite high levels of stress. This stress, in turn, can cause the emission of cortisol, which can interfere with comprehension and normal brain development. The effect of inequitable practices and labels is staggering, but it is not irreversible. Implementing strategies that create a culture of confidence, one that recognizes and values students and their communities, as well as setting high expectations, emphasizing student strengths, and offering personalized learning can reverse the negative effects of otherizing language. So we've seen that low income and people of color face systemic inequities. When exploring why disparities in mental health access and treatment occur, we need to consider a variety of barriers these communities face. These include stigma and the belief that mental health treatment does not work, distrust in a mental health system that's weighted heavily towards white values and cultural norms, lack of adequate health insurance coverage. For example, Latinx children have the lowest rate of public or private health insurance coverage of any ethnic group at 37%. This is nearly half that of whites. Additionally, there are shortages of qualified service providers, particularly providers who are local and speak their languages. Underlying assumptions can leave clinicians less able to read the severity of symptoms among people of color. Studies have shown that clinicians systematically underestimate African Americans' symptoms and conditions. Additionally, logistical issues such as transportation, finding childcare, or getting time off work can make seeking treatment even more difficult. To summarize, low income and people of color are less likely to seek treatment due to stigma, distrust, and lack of insurance. However, when they do seek help, they're less likely to receive proper diagnoses and referrals, and even if they do, they face shortages of qualified providers. Along with other people of color, American Indians may conceptualize mental health problems differently than mainstream Western culture, which can have implications for the assessment and diagnosis of mental health issues. The Diagnostic and Statistical Manual of Mental Disorders, the DSM, has been criticized for being Euro-American centric and for drawing categorical lines that may not apply across cultures. The DSM dictates standard diagnostic criteria for classifying mental disorders, and it is the basis for insurance reimbursement. Thus, our current healthcare system does not take proper steps to be culturally sensitive, which can negatively impact diagnosis, treatment, and insurance coverage. Additionally, years of injustice and discrimination, including violent conflicts, genocide, and relocation, have contributed to historical trauma and unresolved grief. Historical trauma is trauma that spans generations of a particular cultural group that has a history of being systematically oppressed. Examples include slavery, the Holocaust, and the violent colonization of Native Americans. Historical trauma can lead to low self-esteem, depression, self-destructive behavior, susceptibility to violence or aggressive behavior, substance misuse and addiction, and high rates of suicide. Parents' experience of trauma may disrupt typical parenting skills and contribute to behavior problems in their children. Effective treatment requires care that accounts for these environmental conditions, and cultural backgrounds.
And if you look at the history of American education and just the history of America, you can see the legislation that has been put in place that has spurned some of these issues that Black and brown children face amongst our systems. And as a teacher in Howard County and in Washington, D.C., two very dichotomous public education systems, I've seen inequities, equal share of inequities in both systems. In DC, I've noticed inequity from a funding and programming standpoint. Those programs are just not in place. You know, one school psychologist for 4 schools as opposed to 1-to-1. And again, the lack of school counselors and things like that. But I've also seen the inequities for Black and brown children who go to affluent public school systems in the form of access. When an African-American child may be acting out and goes to seek the counselor, they then have an issue, a behavior challenge, and they need to be disciplined, as opposed to they need to seek counseling and really work through some of the trauma they're facing. So there's inequity on both sides. And so we have to really look at the legislations and the programmings that have been put in place and really come from it from that standpoint. Sometimes when we hear all these statistics about Black and brown children, we're prone to think, both white and Black and others, oh, these poor kids, we have to fix these kids. And if that's our mindset in approaching historical trauma, we're already defeated, because it's the students that are not broken. They're experiencing trauma, but trauma is not their identity. And so we have to be very careful that when we're looking at our children, that we're not labeling them, as Megan said, but we're saying, okay, what systems are in place that are causing these traumas and these inequities? And let's go and let's tackle those.
Yeah, really great points. And different cultural groups face different challenges. So American Indians face poverty, isolation, and historical trauma, which can lead to high levels of substance abuse, domestic violence, and suicide. African Americans face racism, poverty, and shame that lead to high levels of incarceration, domestic violence, substance abuse, and PTSD. Latinx communities face language and communication barriers, which can hinder mental health education and access. Immigrants are displaced from their homes, fleeing war, violence, or environmental disasters, and they face PTSD, migratory trauma, and acculturation challenges. Finally, Asian Americans can face entrenched cultural stigma and shame around seeking mental health help.
And go ahead. You can go ahead. I just wanted to point out just one thing before we move on about these challenges. When I was a teacher in Howard County, I was a 5th grade teacher, and I had 2 students that scored the score you needed to get into GT for middle school. One was a young Black female student, and one was a white male student. They both scored the exact same score, so it was 1 point, actually 1 point less than what you need to get in. So as a teacher, I could advocate for them to get in GT. So I wrote a letter and I said, although both these students were 1 point less, I recommend that they get into GT next year. They've been in my class all year. They're both very hard workers. I recommend they both get in. About a week later, the young African-American female's mom called me and she said, oh, they denied your letter to let me in, but thank you. And I said, that's strange, because the young white male's mother called me and said, thank you, Mrs. Harris, for writing the recommendation. He got in. So immediately I phoned the principal and I said, I would like a meeting. I want to know why he was let in and why she was not let in. And so we had a meeting, and they were like, well, he has 2 parents. What does that have to do with anything? Well, it's so rigorous, and she may struggle. I said, I taught both of these students all year. They were in my math class all year. I'm very well aware of what they're both capable of, and they both should be allowed in. It took me 4 meetings to get that girl in the GT. 4. And so again,
these are challenges that we face, but as educators, while we might not be able to change legislation as a whole, what we can do is advocate, right? We see these challenges, and when we see them, we must address them, okay? I had another student, two students, very aggressive, one male, one white male, one black male, both in my class, both very aggressive, both very angry, both experienced complete trauma. One's the white male's dad, I believe, was murdered when he was in second grade, and then the black male was in the system. He lost both of his parents. They both were in my class, both beautiful kids, but both experiencing trauma, and they would act out. What happened was they wanted to pull the black student out of my class, detain him, and put him in a special needs class, the ALS class, which he had no mental, health like MS or anything, but that's the class they wanted to put him in, with the students that had autism. And then the white male, what they wanted to do was pull him out for counseling. And I said, they both need counseling. They both are facing very real trauma. Ms. Harris, this kid, meaning the black kid, he really needs some special attention. I said, they either both stay in my class and receive counseling, or they both have to go. And again, that took me another 4 meetings to get equity and justice for both of those students. So again, these challenges are very real. And while we might not sit at the Board of Ed in DC, we can advocate when we see them. And I just wanted to point that out, Megan. I'm sorry if I.
No, that's great.
So Dr. Harris, we so appreciate your tenacity. You are an exemplar of what most of us should be doing. And I just have to say, as someone who's been in education a long time, I can remember back in the 70s and 80s where we really thought we were going to make tremendous gains. We were on the path to equity and making sure life was better for everyone. So it's really, really hard to look at statistics today, see what's going on, see the stories in the news, and to realize that we have such a long way to go. And if you're like me, you may be listening right now and thinking, wow, this is almost overwhelming. And isn't it truly unbelievable that, in fact, we haven't done better than what we've done? It is shameful. It really is.
And I'm glad you brought that up, because, again, when we look at some stories that are happening in 2020, like the first African-American valedictorian of Princeton in 250 years, when we hear stories like this, are we saying, oh, wow, this first Black African-American valedictorian? Or are we saying, wait a minute, you mean in 250 years, a Black student has not been valedictorian? Where's the inequitable treatment here? Right? And so again, it's how we're approaching these inequities, and it's up to us as educators to recognize all these statistics that Megan is mentioning and say, okay, what can we do about it? And for me, it starts with the mindset. Am I approaching these inequities as if the children are broken or the system? And from what I've seen in my years of teaching, a lot of it is being approached as, oh, this poor kid, versus something's inherently wrong with the fact that Princeton hasn't had a valedictorian of color in 250 years. Or, my friend, she was the first African-American PhD in chemical engineering from Purdue 4 years ago. Like, these things are just shedding light on inequitable systems. So let's tackle the system collectively, starting with recognizing injustices that we see in our own classroom and being an advocate, even if that means you have to put yourself out there. Like I had to go to several meetings. I had another story when I taught kindergarten. I had 2 students in my classroom, one white female, one Black female, kindergartners, both reading on a 2nd grade level. Went to the principal, the white female was out of my class and put in 1st grade in 1 week. The Black female was never removed. To the point that she would sit at my desk and read my emails. And this was about 13 years ago, I taught kindergarten. She could read my emails and say, Ms. Harris, oh, you're going with your friend Andrea tonight. She emailed you. So she was reading and comprehending. And when I would advocate for her to be removed because she was the same age as the white student, they tested the same on the test I gave them. But, because her mother didn't advocate for her, when the principal said to her mother, well, maybe you shouldn't move her, because she had 2 older brothers that I also taught, and both did have special needs. The principal said to the mother, well, we don't want to move her too soon because your 2 older sons, one had autism, and the other one was reading below grade level, that she probably would follow in that trajectory. So we didn't want to push her too soon. So she spent the whole year in my class, despite my ranting every week. So again, we have to speak out to these injustices.
You are so correct. I'm going to open the mics up in just a minute, and we'll give like 2 or 3 people a chance to comment, and then we will go back to the presentation. But before we do that, so I'll let you think about what you might want to say. Before we do that, I want to reiterate some of the things that Dr. Yvette Jackson says about equity. And she's one of our co-authors and a rock star.
Mm-hmm.
And anyway, what she says is that, in fact, we need to think about the mindset of the students. We need to believe that students are capable, have high expectations, and work on self-determination, where students really can tell us of their interests, and we pay attention. And I believe a lot of that could help them. And then the second point I'll make right now is that when we're looking right now at trauma, the lens is really focused on trauma at this time. This is a really good time to work on equity and justice. Okay. Any questions or comments? I tell you what, we can move on. And if you have some, just send us a little message in the chat box and we can open the mics up.
Okay, great. And this is another interactive activity. So let's say the rightmost girls in each picture are 4th graders. Each becomes irritable and isolated at school, and their teachers notice and alert their parents. What do you think the likelihood would be for each of them to receive mental health treatment? What would you expect the challenges to be in receiving quality care? And what would you expect their outcomes to be? Take a moment and share your thoughts in the chat. So to reiterate, what do you think the likelihood is that they receive treatment? What are challenges they might face? And then what are their possible outcomes?
Let's just go ahead and we'll keep proceeding through the slides and we can check the chat box and get back and have a discussion. Okay?
Okay. So in addition to race and ethnicity, geography plays a role in accessing mental health treatment. Families in rural areas often need to travel long distances in order to find appropriate services, since psychologists and psychiatrists are heavily concentrated in metropolitan areas. Having to regularly travel long distances poses a big challenge to receiving regular care and makes mental health emergencies more concerning, since the nearest hospitals and resources may be hours away. Telemedicine is a possible solution. However, poor internet access and coverage in rural areas must be taken into consideration. Personally, I was surprised to learn that the mental health crisis responder for most rural Americans is a law enforcement officer. Unfortunately, people experiencing a mental health crisis are more likely to encounter police than medical professionals. According to the National Alliance on Mental Illness, at least 400,000 inmates currently behind bars suffer from some type of mental illness. This is a population larger than the cities of Cleveland, New Orleans, or even St. Louis. NAMI estimates that 25 to 40% of all mentally ill Americans will be jailed or incarcerated at some point in their lives. Incarceration tears families apart, resulting in trauma, loss of income, and reduced housing opportunities. There is a growing movement to ensure that officers have the skills to safely and responsibly respond to and de-escalate situations involving people with trauma, mental illness, or substance abuse. Handle with Care is a great initiative in Michigan that aims to prevent and mitigate negative effects experienced by children exposed to traumatic events. And Sue Mullane is involved in that. And Sue, if you want to speak to that, please jump in.
Can you see me? I'm not sure if my video is showing, but can you hear me, most importantly?
We can hear you, yeah. We can hear you.
I've been involved with Handle with Care for 5 years, both on state level, trying to get it initiated here in Alaska. Equity starts with information. Equity starts with systems checks. Here in Alaska, for instance, and in West Virginia, there's high pockets of poverty. Handle with Care is cost effective. It's simply 3 questions. Who is this child? What was the experience? Handle with Care. Handle with Care is just an alert system to schools when first responders see a child in trauma. And with the increase of child abuse and neglect given the COVID-19 isolation, we're seeing our numbers rise here in Alaska. I did a presentation to the State Board of Mental Health Trust in March. They're exploring with first responders to see the possibility of initiating the program. It is sweeping the nation. And I just got an alert this week that there's actually an island off the coast of Australia, which I hopefully can do an in-service training at, and in the future, to help them with their domestic violence situation. I'm also helping to assist the island of Bonaire, north of Venezuela, that has a high refugee situation going, to help curb the incidence of domestic violence in Bonaire. So I would encourage all of you to look at the CTTIP, which is a national movement, to contact state legislators and US representatives regarding the systems issues and funding regarding mental health intervention, which includes equity for all children of color, and tag it also with Handle with Care. Thank you. And it's also now in the state of Maryland. I just found that out today too. Thank you, Megan.
Yeah, thank you, Sue.
So
Great.
before we go back to the question we asked, I just want to make 1 or 2 points about Handle with Care. Think about this. If we were working with police officers and had a systems approach that crossed systems, right? So that we didn't end up with people incarcerated who don't really need that. That's not really the solution. There are other solutions. That could make a huge difference. If we made sure that when in fact there are crises, that the people in our police system understand trauma and crises and are able to collaborate with families and consider the needs of youth and where they may be and how scared they may be and all the factors that we could deal with rather than putting someone, behind bars. There is so much more that could be done. So I really am excited about this initiative. Handle with Care, I think, has a lot to offer. And pleased to see that more and more communities are looking at approaches like this. Okay, back to our question.
Yeah, so thanks everyone for sharing. So as Arinthia pointed out, this does reflect that we're making assumptions based on one image without more information, and other people pointed that out as well. You don't know if this is a single mom or that just her husband's not in the photo. So yeah, everyone brought up really good points. Some people mentioned that both would get referred. However, one of the parents might pursue it, or one might have private insurance. So yeah, there are just so many different factors that factor in. But yeah, we need to make sure that we're not making split decisions based on prejudices and stereotypes. Great. And so here we can see the general distribution of mental health professionals nationally. So the dark green indicates rural areas with high shortages of mental health professionals. The dark blue indicates metropolitan areas with high shortages of mental health professionals. So overall, you'll notice that the West and the South have the most significant shortages. While the Northeast has a lot of white in the lighter colors, showing more coverage, the West and the South is really where we have a lot of shortages. Okay, so we've seen that mental illness and suicide are increasing, but we need to understand why. If we step back, we see that socioeconomic status, adverse childhood experiences, family trauma, untreated mental illness, and academic pressure can lead to anxiety, depression, and trauma. Prolonged or severe anxiety, depression, and trauma can in turn lead to mental illness and even suicide if left unaddressed. So now we'll explore some of the causes and consequences of mental illness. So experiencing trauma as a child puts you at risk for lifelong health effects, such as poor physical and mental health, substance abuse, and risky behaviors. So roughly 60% of Americans have experienced at least one adverse childhood experience, while 1 in 6 has experienced 4 or more distinct types. Both household and community socioeconomic status in childhood is associated with the likelihood of experiencing multiple ACEs. So in 2019, the Education Advisory Board conducted a survey of 1,900 educators and found that 34% of respondents reported an increase in students with behavioral and emotional challenges, 29% of which reported a significant increase. They then explored potential causes for these challenges, and a history of trauma, unmet mental health needs, and community turmoil were top of mind. As most of you already know, experiencing trauma as a child can undermine normal brain development and impede the ability to cope with stress, establish healthy relationships, and regulate attention, emotion, and behavior. Thus, trauma negatively impacts students' abilities to focus on academic learning. Stay tuned on this topic as Dr. Mason, Dana, and myself are writing a book on children's mental health, and we discuss why the neuroscience of trauma is important, and we explore how we can build awareness and education on this topic into professional development.
So Megan, if I can just add right here,
Sure.
when you look at the third circle, and we look at trauma and heightened fear and anxiety, it doesn't just result in difficulty in learning. When we think about the mental health and the well-being of students, those are tremendously impacted as well. So what we know is if we can get to the root causes, right? And some of them are related to family, and some of them are related to society and culture. And if we can start to make changes there, then we may have a chance of having a significant impact. Dr. Harris, do you want to say something?
I was just going to say that's really, really good. I'm looking forward to that book because we know that the trauma has a definite impact on the brain, but the brain has plasticity. So it's not like all hope is lost. And so that I'm just shaking my head like, yes, this book is needed. It's necessary because the brain has plasticity. And if we can equip educators with the proper brain education as far as handling trauma is concerned, we can rewrite some of the negative pathways that have been written in the brains of these children so that the trajectory changes, if that makes sense.
Yes, exactly. And so as teachers, students may express trauma and stress in a variety of ways that you may have noticed. It's important to be mindful and compassionate, recognizing that bad behavior is often a cry for help. Students may react to trauma with anger, withdrawal, or aggression, which can increase the risk of abusing drugs or alcohol, engaging in risky sexual activities, or being involved in juvenile crimes. So I have another poll here. So which manifestations of trauma have you witnessed most often in your classrooms?
We'll share the results with you all in just a moment, but it's interesting to see that many of these are being witnessed in the classroom. Got a few more participants that could log in and answer, and we'll share the results in just a minute.
Okay, great. And so as we know, the consequences of trauma and untreated mental illness are significant. Oh, here we go. So it looks like learning and or ADHD disorders are most common. But yeah, there's a good spread. Withdrawal, anger, depression. So we're seeing all of them. Great.
Can I just add too, there was a comment that in fact someone wished they could pick more than one. And when I looked at this list, I felt the same. It's like, I know that these are prevalent. And it's amazing how often you see the impact. If you open your eyes and you're conscious and aware, how often you'll see these things in the classroom.
Mm-hmm. So the consequences of trauma and untreated mental illness are significant. More than 1/3 of students ages 14 or older who experience mental illness will drop out of school. This greatly limits their job prospects, earning potential, and life expectancy, and it increases their chance of relying on welfare or becoming incarcerated. Additionally, youth suicide has spiked recently with a 56% increase between 2005 and 2017. A clinical psychologist recalls, "I have seen how we misunderstand, exclude, and punish students with mental health problems. I think of the 5-year-old who qualified for gifted education in his local magnet school but was denied admission because of his speech difficulties. Of the high school student with autism who was discouraged from taking an AP class he qualified for because his behavior might become challenging. Of the college student who was failing all of her classes because she was homebound with debilitating panic attacks." So overall, we must reframe our perceptions and responses to mental illness so we can better support youth in recognizing their potential. So here are some risk factors to be aware of, as well as protective factors you can integrate in your schools. Protective factors help reduce children's vulnerabilities to stress, anxiety, and mental illness, and school leaders are responsible for fostering these. Creating a compassionate environment, developing caring relationships, and promoting growth mindset are all ways you can help students become more resilient. For example, if we create safe, stable relationships, there will be less bullying. While protective factors are particularly crucial for students at risk of mental illness, they benefit all students, as everyone experiences trauma at some point. COVID-19 is a great example. We're all experiencing unexpected stress and uncertainty right now, and protective factors can help us all stay happy and healthy. So I think I saw a comment on this in the chat, but COVID-19 has brought increased stress, anxiety, and uncertainty about the future. And unfortunately, COVID is increasing existing inequalities. People of color and those living in poverty are more likely to lose income or a job, and thus their health care. And they're more likely to be working in essential jobs with higher risks of infection. These individuals are less likely to have high-quality health insurance or paid time off, and are more likely to have pre-existing conditions, which can make coronavirus up to 10 times more deadly. A recent study by scientists and researchers from Johns Hopkins, Emory, and the University of Mississippi found that counties across the country with disproportionate numbers of African American residents accounted for 52% of diagnoses and 58% of coronavirus deaths nationally. Crowded living spaces, higher instances of underlying conditions, and lower rates of health insurance are likely responsible for these staggering numbers. With increased parental stress, there are concerns of increased ACEs, and shelter-in-place orders leave youth with few options to escape. Additionally, depression among teens may increase as a result of physical distancing and missed life events, which could increase the risk of teen suicide. With loss of income and health coverage, families are less able to access quality mental health treatment. Emphasizing protective factors are ways we can help teens deal with COVID-19. Creating routines, encouraging mindfulness, and promoting connection and community are key.
I wanted to jump in here as a teacher in DC, when COVID-19 and the quarantine first came up, the people of DC scrambled and raised all this money to get all these laptops and iPads so that all students could have iPads. And one thing that those of us on the board and in the legislative system found is that you can give a kid an iPad, but do they have internet? Okay, you can pay for everybody to have internet, but do they have electricity? Okay, you can pay for everyone to have electricity, but as an elementary school educator, how is my second grader going to get on if I am an essential personnel and I have to go to work? Or I'm working and I can't get them on. And so as a mom of 4, I have 3 elementary kids, and we have 2 laptops in our house. And sometimes we can't all get on at the same time. And we're sitting here trying to juggle how we can work at home. Both of us have jobs, and we have 3 kids that need to get on as well. So there is increasing disparity due to COVID-19. However, I think the bright side is that we can look at the barriers that are the barriers to distance learning, right? And then we can attack those barriers so that we're not putting Band-Aids, like everybody gets an iPad, on things that need a little bit more. And I think one of the biggest things is mindfulness for elementary kids, because no matter what we do, they are going to experience some stress and anxiety because it's a pandemic. Like, let's be real. It's not like the whole world just automatically decided to go online. No, we were forced online due to a global pandemic. So that is going to give kids some types of anxiety. You know, we have kids in 4th grade that are having night terrors and can't sleep. I think really, first things first, before we try to teach them reading, writing, math, and algorithms, let's teach them how to use mindfulness to center themselves when they are anxious, when they are fearful. And because mental health is key for academic success. And you can't put the cart before the horse, because we can have all these wonderful distance learning programs, but if I can't access it mentally because I'm freaked out and I'm anxious and I haven't seen my friends in forever, and I don't have mom there to calm me down, and I may not be able to get to see a mental health professional for a number of reasons, like you mentioned. As a 2nd grader, as a 4th grader, I've been taught how to use the techniques of mindfulness to calm myself down. And I think let's start there with the mental health of distance learning in a pandemic, because it's not just distance learning. It's distance learning in the middle of a pandemic. It's very different, because there are kids that have been doing distance learning for years, but this is very different. So I think the fact that COVID-19 is here, we have to come at it from a mental health perspective for all these students, especially for our younger kids, because a lot of people tend to focus on high school and suicide and things like that, but we're seeing 2nd graders that can't sleep. We're getting calls, all the time. What do I do? My daughter can't sleep. She's on the computer doing her lesson, but then all of a sudden she can't breathe because she's hyperventilating. So I think we, as mental health people, we have to really look at distance learning from a mental health standpoint, and what are the key things that we need to teach them so that they can survive this pandemic, if that makes sense.
Dr. Harris, wow. Yes, you are so right. And I also want to say there are some other things that we know teachers are doing. I want to give a shout out to teachers who connect with this, who realize the importance of maybe having appointments, office hours, virtual office hours, of giving peers a chance to connect with other peers, of doing some exercises beyond mindfulness. There's even academic assignments you can give kids that will help them, give them a choice. I don't know if we automatically say, tell me how you're feeling and what your fears are. But you could maybe have that as a choice between 1 and 3 and 5 things a child might do in order to get the chance to express how he or she is feeling. And I'm thinking about Suma Lane and art and music and realizing that during this time, there are things that we can do with art and music and even physical activity that will help kids feel empowered, a sense of fun and play. And again, some of our fellows in New England have done wonderful things. They've brought a sense of humor to academics. So they'll dress up in costumes, or they'll have these crazy competitions, ways to engage students that go beyond the academics. These things right now are so critical because they help to establish relationships, connections, and a sense of, wow, this is fun. Somebody knows what I like, right? They're paying attention to me. And those things right now are critical.
Thank you, Chris, for mentioning that. I just posted on Basecamp a webinar I had with Eric Jensen a few days ago, and we addressed the issue of choice and giving children choice. On this slide regarding COVID and exasperating numbers, I also want to mention homelessness and unemployment. We know through research that congregate care is an issue regarding TB, for instance, crowded living conditions. So when we see massive unemployment, we're going to see more homelessness, we're going to see more vulnerable children who lack food and medical treatment. So again, this is an ecosystems issue. We've got to change those variables for the better good of society and for the health of our communities, which means we have to be advocates. Thank you. So look for my post on Basecamp and email me should you have any questions regarding Jensen's conversation regarding stress in the brain.
So Megan, why don't you jump ahead to the solutions?
Okay, yep. So next we're going to talk about how we discuss the disparities. So you guys have mentioned some great ones. So investing in culturally sensitive services is a great way so we can help develop compassionate and culturally sensitive mental health programs for teachers, parents, and students. Schools can improve mental health literacy and highlight the benefits of addressing mental health issues early. Schools can also help families better understand and navigate enrolling in health insurance, and schools who don't have funds for mental health services can potentially bring them in-house by working with families and lobbying for Medicaid funding. In addition to educating school communities on mental illness, a major focus should be on reducing stigma. So this can be done through anti-stigma campaigns, as well as regular education and authentic discussion around mental health. So Dior Vargas grew up in New York and dealt with major depressive disorder. In order to combat the stigma and loneliness many people of color face, she developed a program where people of color share pictures of themselves and identify their mental health issues. So schools and parents can provide support by openly discussing mental health and creating a safe space for youth to feel comfortable sharing.
So Megan, as I'm thinking about it, we've really covered a lot today, and I want to make sure that we have time for a Q&A. Let's just jump ahead. And if you have questions, now's the chance to ask them of either Megan or Orinthia. So let me start, okay? I'm looking at all these slides that we'll get to sometime in the future, and I want to say that, you know, this theme is not going away. With the CTLC and our work in New England, we're going to continue to address this. We are going to be tenacious because these disparities need to end, and we need some determination behind this. So we would like you to think about what you could commit to. And Orinthia and Megan, what advice would you have to our audience today in terms of what they might be able to commit to?
Yes, I think I agree with Orinthia. I think mindfulness is kind of the easiest low-cost option that's highly effective. And I had one slide on this, but like mindfulness, meditation, yoga, and breathing is huge. And Montgomery County Public Schools has done this. And so they've integrated mindfulness as a warm-up at the beginning of class. They've created a mindful intervention room where students can drop by and just take a minute to breathe and reset themselves. And Montgomery Schools has also provided YouTube videos, like mindful moments that they're sharing with students, staff, and the community to just manage anxiety and stress. And so I think mindfulness is just the easiest and most cost-effective way to just really help people reduce anxiety and stress.
So, you know, what I want to say about that is that mindfulness is good for you too. It's just not for students and families.
Mm-hmm.
It will increase your sense of well-being. So your self-care right now is critical. I've talked to so many educators who are under enormous stress, working long hours, round the clock. They can't tell the difference between a Saturday and a Friday. You know, there's so much going on. And self-care is really, really critical. Okay, so Dr. Harris, what should people commit to?
I was going to say, commit to questioning your personal filters when it comes to mental health awareness, and be willing to reframe your perspective when necessary and advocate. Someone mentioned in the chat that we all have personal filters. We do. And we all have our own experiences. We do. So I would just encourage everyone to question your personal filter. Reframe your perspective when necessary, when you recognize that your perspective is the result of historic and systemic racism, and then be willing to reframe it. And then advocate.
So what you're saying is put yourself in the other person's shoes.
Mm-hmm, for sure.
Think about what they're going through, what it must feel like, what their history has been, what the cultural history has done. Right? And then in a few weeks, or is it next week, sometime soon, we have a couple upcoming webinars. One is on courageous conversations.
Good one.
With Maria Restrepo-Toro. And that will be a continuation of things we can do to increase our own awareness, our consciousness, and to act on that consciousness. Then next week, we also have a webinar on visioning for the future of education. And believe me, when we think about the future, envisioning equity and resolving trauma or alleviating trauma are going to be two huge components. Now is the time. Any last minute questions? If not, you can always contact us. We can respond. If you want to join Basecamp, send an email to either Dana or me, and we'll figure out how to get you onto Basecamp. There are ways. And that will give you a chance to dialogue with some of us more closely. And I'm thinking, when I think about Basecamp, Dana, of schools. And your school could join our collaborative. Now, so far we've worked in New England, but if somebody outside the New England area has an interest, let us know. Dana, do you want to say anything?
Yes, please. Thanks, Chris. Thank you, everyone, for joining today's webinar. As Chris said, the Childhood Trauma Learning Collaborative is working with schools in New England. So if you are interested in joining that, please visit the CEI website or the New England Mental Health Technology Transfer website for more information, and contact us via email. As she also mentioned, we have several upcoming webinars, including a Visioning for the Future of Education 3-part webinar series, Courageous Conversations, which is the one that Chris referenced that's happening in 2 weeks, and then Trauma-Informed Yoga in Schools. You can find all of those at edimprovement.org. As well as in the slideshow, we'll have a link to a PCTV series we're doing with CEI's Director of Heart-Centered Learning, Michelle Rivers Murphy, and Chris is co-author on several books. It's called A Path Towards Positive Health and Well-Being, and you can visit those at pittsfieldtv.net. Thank you so much for attending us. Today's webinar was provided with funding from the Substance Abuse and Mental Health Services Administration. They require us to evaluate our services. Attendees providing their email address will have an evaluation survey 24 hours after the close of today's event, along with the slide presentation. This follow-up email will also have links to request CEU credits and participation certificates. We really appreciate your honest, anonymous feedback, which helps us understand how to plan for future meetings and programs. We hope that you will be able to participate in upcoming webinars. And for more information, contact the Center for Educational Improvement at info@edimprovement.org. Thank you so much for joining us. And with CTLC fellows, will please remain on the line for a brief meeting.
Thank you again. Wish everyone the best. And Megan and Orinthia, thank you so much.